Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. I wanted to talk to you about the adductors and the role of the adductors in pelvic floor health. And that's what this video is all about. And I show you a very, very good exercise you can do to strengthen it while you're able to maintain a good overall presence of your body in this move. Highly effective and definitely necessary for everyone, especially the ones with pelvic floor dysfunction. So stay tuned. Okay, let's talk about adductors. Adductors are these muscles of the inner thigh, and when you don't have a good stability in your pelvis, what ends up happening is, in essence, in movement, in just walking and everything else, we tend to use the inner thighs more to kind of support ourselves here. So you're not walking around like that, but what's happening is you're internally rotating your hips a lot more than you need to. It's not neutral anymore, and that really sets you off wrong in the SI joint and in the hips. So in order to do proper exercise for the adductors, we have to have proper positioning of the stabilizers, which is this rectangle, and the positioning of your body. It's easy to duplicate an exercise mechanically and not functionally. So for this, I'm going to use my assistant, Desiree. So Desiree, come over here. I'm going to be right in front of you. Go ahead and lay down on your side. So you can do this exercise at home. Use a chair just to be able to lift your foot and place it on the chair. If you're not able to lift yourself up the way we're about to show you, make sure you do not do this exercise. Otherwise, you can hurt yourself. So for this, the outside of your ankle, your hip, and the elbow are all on the same straight line. Your torso is in a rectangular shape. So can you hunch forward? So you're not going to be like that, or you're not going to stick your chest out, or you're not going to have your body, this is incorrect, so go to neutral, and you're not going to be holding your head forward or looking up or any variations of that. You're engaging your barrel, which is a video I've done on my other channel. We're going to make sure that we put here so you can see. And your barrel is engaged. The whole pelvic diaphragm and abdominal diaphragm are talking to each other. That video is going to show you what that's all about. And then you proceed by not lifting or pushing off this foot to get yourself up. You're placing your top foot on the table, on the chair, and go ahead and lift yourself up just like that. So can you show the wrong way that most people do? So she's going to be, go ahead and pushing off with the foot to get herself up. That is not the proper way to do this exercise. So if you are not able to lift yourself up, don't do it because you're going to hurt yourself. Can we show what the back part is going to look like? So obviously you do this on both sides. Once again, bring your elbow back here a little bit. Your whole body is nice and straight. This is rotated that way. Bring this back like so, just like that, and go. Just like that. And when you get up there, you can go down. When you go up there, you can just hold it for, count of however many you can. If it's 2 or 3 or 4, whatever, just go ahead and count. And there is no trophy in holding yourself up there the wrong way and stressing anything else. The requirement is to make sure your barrel is engaged, your torso is neutral, you're not kyphotic, your head is not going forward or anything like that. This exercise is actually more difficult to do than it seems. So give it a try. If you have any questions, make sure you use one of the methods of contact in the description box. If you need to be checked for functional movement in your body and see how much of your movement is contributing to your weak pelvic floor, again, contact me and make sure you subscribe to the channel. Until next time, take care.